The female pelvis is one of the most fascinating and complex regions of the human body. It serves as a strong bony basin that supports the weight of the upper body, provides attachment for muscles, and houses vital reproductive, urinary, and digestive organs. The pelvis is not just a rigid structure, it is designed for both strength and flexibility. In women, its unique shape and proportions also accommodate childbirth, making it slightly wider and more rounded compared to the male pelvis. In this view, you can see the harmonious arrangement of bones, muscles, and organs, each playing a crucial role in health and function. The skeletal foundation of the pelvis is formed by several bones working together as a unit. On each side, the hip bones, made up of the ilium, ischium, and pubis, join at the front through the pubic symphysis, and connect at the back to the sacrum, which itself rests on the coccyx or tailbone. This sturdy arrangement forms the pelvic girdle. Its job is to provide support for the spinal column and create a protective ring for the organs inside. The contours and openings within the bones are shaped to allow blood vessels, nerves, and the birth canal to pass through without obstruction. Surrounding the pelvic bones are powerful and precise muscles that give the pelvis both stability and movement. From the front view, you can see the layers of abdominal and hip muscles attaching to the pelvis, as well as the internal pelvic floor muscles. These muscles help support the bladder, uterus, and rectum. They also play a role in posture, core stability, and even sexual function. Weakness in these muscles can lead to problems like urinary incontinence, while strong pelvic muscles can contribute to better health and stability throughout life. Inside the pelvic cavity, we find the organs most central to female reproductive health, the uterus, the ovaries, and the fallopian tubes. The uterus is a muscular, pear-shaped organ designed to nourish and protect a developing baby during pregnancy. On each side, the ovaries store and release eggs, while the fallopian tubes transport them toward the uterus. Ligaments hold these organs in place while still allowing some movement. The close positioning of the urinary bladder in front and the rectum behind shows just how compact and efficient this space is. The bladder is located in the front part of the pelvic cavity, just behind the pubic bone. Its muscular walls allow it to expand as it fills with urine, and contract to empty through the urethra. The female urethra is relatively short, which unfortunately makes women more prone to urinary tract infections. The bladder works in close coordination with the kidneys, which filter blood to create urine, and with the pelvic floor muscles that help control its release. Its location, directly in front of the uterus, also means that pregnancy can affect bladder capacity and function. At the back of the pelvis lies the rectum, the final section of the digestive tract. It stores solid waste before elimination through the anal canal. Its proximity to the uterus and vagina is important to note, especially in medical conditions like endometriosis or pelvic inflammatory disease, where one organ's issues can affect another. The muscles surrounding the rectum are essential for controlling bowel movements, and healthy nerve function is required to maintain this control. This region's tight arrangement highlights how interconnected the pelvic organs are. The pelvis is richly supplied with nerves that control both voluntary and involuntary functions. The sacral plexus, a network of nerves emerging from the lower spine, sends branches to the pelvic organs, muscles, and lower limbs. Some nerves are responsible for sensation, while others control muscle contractions or regulate automatic processes like bladder filling. These nerves are vital for sexual function, continence, and movement. Injury or compression of these nerves can cause significant pain or loss of function, making their protection essential during surgeries or childbirth. The pelvic organs receive their blood supply from an intricate network of arteries and veins. The internal iliac artery is the primary source, branching into vessels that feed the uterus, ovaries, bladder, and rectum. Veins carry deoxygenated blood back toward the heart. Because of the close relationship between blood vessels and other pelvic structures, surgical procedures in this area require great care to avoid bleeding. During pregnancy, blood flow to the pelvic region increases dramatically, supporting the growing fetus and preparing the body for delivery. Looking from below, we can see the pelvic floor muscles forming a supportive hammock that closes off the base of the pelvis. This muscular floor supports the weight of the abdominal organs and helps control the openings for the urethra, vagina, and rectum. In women, these muscles must stretch significantly during childbirth, but they can also be strengthened through exercises like Kegels to improve bladder control and sexual health. A strong pelvic floor is vital for maintaining continence and core stability. From a sagittal, or side, cross-section, the spatial relationship of pelvic structures becomes even clearer. The bladder sits in front, the uterus lies in the middle, and the rectum is at the back. Between and around these organs are layers of muscles, ligaments, blood vessels, and nerves. This side view shows just how compactly these vital systems are arranged, and how any change in one structure, such as pregnancy, a tumor, or inflammation, can influence the others. Understanding this layout is essential for both medical professionals and patients who want to take an active role in their pelvic health. The female pelvis is a remarkable combination of strength, flexibility, and delicate function. From supporting daily movement to enabling new life, it is a vital region that deserves our care and understanding.